are marking National EMS Week this morning by focusing on children and their safety. Michael Schwartz joining us live from the helipad at Strong Hospital this morning. Michael, we are looking at the incredible work that the crew of Mercy Flight does now.
Yeah, hey, good morning, Matt. That is Mercy Flight Central behind me. Just came in from Canandaigua here to the helipad at UR Medicine Strong Memorial Hospital. This is the scenario, life-saving measures, bringing children into this unit for all different ailments to save their lives. I'm with Ben Sensenbach from Mercy Flight Central. Explain what goes into landing this helicopter here from wherever it may be.
Yeah, so the landing part is actually the easiest part of what we do. Our pilots have thousands of hours of experience. A lot of them have former military backgrounds, like Scott here. Well, a lot of what goes into the flight is the care in advance, right? So we're here talking about EMS for today. We take care of a lot of pediatric patients. Mercy Flight Central has a lot of pediatric specific equipment. Our ventilator, we can do neonatal ventilation, so we can take care of infants and neonates. We have very special restraint systems, so we can convert our stretcher to safely transport pediatric patients. We have a transport isolette in the event that we need to keep a little kiddo warm. We can load that up on the aircraft in advance. All of our nurses and paramedics have extensive pediatric training. Everyone is certified in neonatal resuscitation. We spend a lot of time training to interact with the family members of these poor kiddos. So this aircraft is a workhorse, so we have the ability to bring family members with us. So if it is a little chaotic, we have a philosophy of speed, right? So we try and spend less than 10 minutes on any trauma scene. So to a parent, that's pretty hectic, right? You see us kind of scrambling around to get this kiddo loaded in such a short period of time. But having a big helicopter like this, we're able to load the aircraft while it's running. We're able to offload the aircraft while it's running, and that lets us do a lot for the kids. We can shave a lot of time off. In general, for what it's to drive, we can cut that time in half.
Just whatever, because we were with EMS. Now we're with amazing. Hey, I'm Michael. Nice to meet you.
Nice to meet you, Shane.
Nice to meet you, Shane.
Hi, Katie.
Katie, nice to meet you. Thank you for that stellar landing. So there's always 3 people on board. How many people?
In a minimum, so you've got your pilot, you have a flight nurse and a flight paramedic.
So you have medical backgrounds.
Oh, yeah, absolutely, absolutely. So, and it's very extensive. So you have to have minimum requirements to even interview. It's a very complicated interview process.
A lot of hats.
Yes.
A lot of hats
Yes.
you wear.
Yes.
Whether it's EMS, whether it's by helicopter. Inside there's a whole layout. There's, of course, machines you were seeing.
Yeah, we could see it.
So the back of it?
Yep. So this is what you call a clamshell. So this is this helicopter is a rear load helicopter. So this allows us, we could take that sick kiddo and we could pull this stretcher right out and head right on in with it. We don't have to offload a sled or anything like that. You can see we've got a ventilator, a cardiac monitor.
Everything on board.
Everything's
so
on board.
efficiently. One thing I want to ask you, parents traveling them, we were asking the EMS about that. What about helicopter?
Yeah, so there was a little hiatus during COVID, but we were able to transport parents again. The way it would work is the flight paramedic, we would take the parent out to the pilot so they could brief them, because the parent actually is going to ride up front with the pilot. That way we put a headset on them, they could talk to the pilot, they can understand the safety procedures, and we can be in the back just taking care of their child. We don't have to worry about trying to communicate with them. We can just focus on this injured or sick kiddo. It's obviously a terrifying time for a parent, and our pilots are good about kind of explaining things.
Much training.
Yeah,
so much training. Well, we're going to bring in the team from Strong Hospital, UR Medicine, for the next segment at 8:30. But unbelievable work what you do, then the coordination with Mercy Flight Central. So many hats. Everyone involved is not just doing one task. They're doing so many to save children's lives, and we appreciate them each and every day, children and adults. We'll send it back to you, and we'll see you soon, live from the helipad here in Rochester.
We are marking National EMS Week this morning by focusing on children and their safety. Michael Schwartz joins us live from the helipad at Strong Hospital. Good morning.
Hey, good morning. What an amazing view up here, but even more amazing is the work that people like Shane and Katie do each and every day. It's one of the bigger aircrafts, this Mercy Flight Central, but it is packed in here, making sure they have all the medication, everything that goes in here. Once they get to the hospital, where Dr. Katie Labarge and Dr. Wakeman will then meet the patient. So why don't we open the back, Katie, to show how the stretcher then comes out here. You're down in the trauma unit, right?
That's right. So we're waiting for the patient down in the critical care bay. We're anxiously awaiting the patient and potentially the family.
And then Dr. Labarge, you're then coming right here once it's clear.
Yes.
To then meet the patient. And then what is your assessment? What are you doing?
So as I come out to meet the patient, the flight crew will actually remove the patient from the helicopter. I start talking to the patient first so that I can assess their airway and see what their mental status is like.
And then see, any what they need, that care. And then
Exactly.
There's a lot of communication.
Absolutely. So communication is key, and that starts pre-hospital from before the patient even arrives. When I receive a call from medical control to learn about the patient, we notify the trauma team, the pediatric emergency medicine team, to mobilize our resources early, and then we continue that line of communication when we meet the flight crew out here.
A lot of people don't realize just how much is on here. Shane, if you wanted to show the viewers at home all the medication, maybe I could help you bring it over here to show. There's so much medication and supplies that go in to the Mercy Flight Central. Dr. Labarge, what is important for parents to know about the care that they have in the air to the time they come in the hospital? You don't want to think about it.
Right, you absolutely don't want to think about it, but if parents find themselves in this situation, they can rest assured that the team in the air has really all the supplies they need to help manage the patient. So that starts before they even arrive to the hospital. We help continue that care and assessment and get our surgical specialists involved, our different imaging resources. So we have more resources that we can offer to continue to provide that high level of care. But it really starts in the field before they even come to us.
Dr. Wakeman, I've done stories with Miracle Child's for Golisano. We've done stories with children who have had trauma. To see that is just so heartbreaking. But the work that goes on here at Golisano and Strong is nothing short of incredible.
Well, thank you very much. We certainly do everything that we can to take care of it for the injured child and also as well the family. As you can imagine, it's a big thing for the family, and we have a lot of resources in the Children's Hospital to help support them really every step of the way.
And the EMS workers, it's EMS Week. Specifically today is EMS for Children Day. I mean, what EMS do each and every day. I know you rode with ambulance, in the ambulance with EMS workers.
Exactly. I've been with the local fire departments, the ambulance companies, and our EMS providers really help connect us to the community. They help initiate that care prior to coming to the hospital, and there's a lot of injuries and a lot of things that happen before we even see the patient. So we really rely on them to provide excellent care for our patients.
Well, I'm glad we could be out here. I'm glad that we could be, this is a non-patient carrier, so we could be out here without masks, but we are in a great a setting to be able to look forward to brighter days, but we hope there's more brighter days in terms of your patients, but we appreciate all that you do. Thank you so much. And thank you to the Mercy Flight Central crew, the EMS crew. They actually have to head out. So they're going to pack up, Ben's going to pack up Mercy Flight Central, and they're going to head out so they can continue the life-saving measures that they do each and every day. Katie, Shane, thank you guys so much. Be well and stay safe. We'll see you guys soon, and thank you to all the first responders out there, all the EMS employees on this EMS week. We're going to send it up with them in the skies. They're about to take flight. We'll see you guys soon.
Very cool what they do, and what a cool close-up look.
I know, we see it so often in the air,
Yeah.
but to get a close-up look is very rare and very unique. So thank you, Michael.